Hello everyone, my name is Prashansa Puri and I am a DPS Rewari alumni. Currently, I'm pursuing physiotherapy in Manipal University in Manipal, Karnataka. I am a final year student right now. I'd love to thank Miss Sunita Chopra, the principal ma'am of our school, for giving me this opportunity to come and speak about my career and its benefits to all of you. I'd love to be connected to the school in future as well. So now I'd like to start my topic, which is a small session basically on physiotherapy, what it means, how it works, and what are its benefits for you guys, for your parents, and for your teachers. So I'm going to be sharing my slides and let's get started. What is physiotherapy? Okay, so you guys see a lot of words on your screen right now, correct? Rehabilitation, treatment, practice, movements, physical, mobility, anthropometric, biomechanics, behavioral, assessment, cognition. There are a lot of words which come together to make a subject called physiotherapy. Okay, physiotherapy does not only deal with ortho conditions of bones and muscles, it also deals with conditions related to your cardio, which is heart, pulmonary, which is lungs, nervous, which is your brain, spinal cord, and the neurons, and renal, which is your kidneys. Okay, so who are physiotherapists? Physiotherapists are basically highly qualified, degree-based medical professionals. How? Highly qualified, basically they have a 4.5 year course, of which 4 years is for their learning process and 6 months is of internship, hence the degree. And they work with doctors and other allied health sciences students, hence medical professionals. What does a physiotherapist do? They have four basic functions, that is facilitate recovery, optimize movement, improve function, and manage pain. Let's just take an example here. So maybe someone from your family or someone XYZ person undergoes a surgery. So after the surgery is finished, he or she is shifted into the recovery room. So what happens there? The incision site might hurt, the patient might not be able to breathe properly, or the patient might not be able to do his daily living activities in his own independent way. He might not be able to move around. So this is where a physiotherapist comes into role. The physiotherapist helps the patient get back into daily living and perform his activities independently. Okay, hence facilitation of recovery, optimizing of movements, improving function, and managing the pain. What does a physiotherapist treat? Like I told you in the first slide, physiotherapist does not only deal with ortho conditions, they deal with other conditions as well. That's acute pain. So anything that ranges between 1 day to 1 month is known as acute pain. Anything which ranges from 1 month to 3 months is called chronic pain. Then there's neurological and degenerative disorders. What do these include? Neurological disorders basically include any kind of brain related or spinal cord related or your neurons related disorders. Okay, so for example, if someone gets a brain stroke, then maybe half of his body is paralyzed. That's when physiotherapists come into role. They treat that half portion of the body and give the patient an independent life again. Then there's degenerative disorders. Maybe you might have seen a patient or a family member or someone you know who has arthritis. Arthritis is a problem of the joints and the bones and leads to a lot of pain in the patients. This is where again physiotherapists come into action, where they manage the pain as we discussed in this previous slide, and they optimize movements. And the last one is chest infections and related disorders. So looking at the current scenario where COVID-19 is on a rise, so after the patient has recovered from COVID, there are a lot of exercises, breathing exercises, which can get back the lung capacity of the patient to normal, because corona affects your respiratory tract and your lungs. Hence, physiotherapy, that is the breathing exercises, are very important to get back to a normal lifestyle. So how do we work? What do is when a patient comes to our department, we physically assess the patient. We do a physical examination on the patient, and based on that assessment, we diagnose what exactly is the patient's problem, and then we go on to the treatment of the problem. And what modalities do we use? We use strapping, rehabilitation, electrotherapy, hands-on therapy, and moist heat and cryotherapy. Cryotherapy is cold packs, okay? So all of these words might seem a bit new, but then I'm not going to go into depth of these. If you really want to know about all of these, you can Google one of these words or go to your YouTube and put up the name there and learn about them. Okay, so we'll move on to the main topic for which we are here right now, which is your online classes. So online classes, even I have been attending a lot of online classes for the past 2 years now, and so I know how we sit, what we do, and how everything goes about. So the first and the main topic for discussion in online classes, how we sit. And I know this is not how we sit, but this is exactly how we are supposed to sit. Our shoulders should be relaxed. We should have a back support. We should have arm support. Our thighs should be horizontal, that is parallel to the ground, and our knees should be perpendicular to the floor, and feet should be flat on the floor. It shouldn't be like this. It should not be like this. It should be flat on the floor. Our eyes should directly face the laptop screen. If not, if the table is not according to your eyes or not according to the eye level, not to your eye level, you need to put pillows under the laptop and then put the laptop on a level so that your eyes directly face the laptop. The laptop should not be down, the laptop should not be up. It should be in your eye vision. Okay? Shoulders relaxed. Otherwise, your neck muscles might get spasmed or might hurt. Back support so that you do not suffer with lower back pain. Arm support so that your biceps and your triceps are relaxed throughout the 4 to 5 hours of online classes. Thighs should be horizontal and not placed in weird positions so as to minimize the pain. And feet should be flat on the floor to avoid any kind of pain or abnormalities. Okay, as you can see in the picture, there's a distance of 18 to 24 inches between the person's eye and the laptop. It is a very optimal distance which should be maintained so that your eyes do not feel fatigued. Fatigued as in get tired. Okay. So basically what happens is we have online class for 4 to 5 hours, say 6 hours almost every day. So between those sessions, it is very advisable to get up after every 1 hour or 1.5 hours and do a couple of exercises which will help your body relax and get back into routine. Okay, so it's basic 6 to 7 exercises which we're going to quickly brush through. Okay, the first one is neck stretches. So neck stretches, there are these 8 types of neck stretches which you can perform. The first one being the very simple one. See, just tilt your head to the right side and then tilt your head to the left side. Right side, hold it for 10 seconds and then get back to the center and go to the left side and hold it for 10 seconds. Okay, the second one, as you can see in the picture, it's the same as first except for the hand. You use your hand to push your neck a little bit to the same side. Hold it for 10 seconds and then release. Come back to center and then the second side. Go, hold on for 10 seconds and then back to center. Third exercise, you take your chin towards your chest. You try touching your chin to the chest. Hold there for 10 seconds and then come back to center. Next one, neck rotation. You start from your right side, rotate your head, come back to the left side and come back to center. Right, up, left and down. Okay. Next one is isometric strengthening. What if you do in this is, you place your palm of your hand in front of your head on your forehead and then push your head backwards and your head pushes your palm in the front. So basically your hand is pushing it back and you're pushing it in the front. So there's a strengthening exercise going on here for your neck. The next one is again isometric strengthening but from the sides. The first one was from the forehead. Second one is from the sides. Then there is combination stretch. What you do in this is, if you're stretching your right hand side, take your right hand to the left side, pull it with your left hand along with taking your neck to the left hand as well. So basically you are stretching your neck and your shoulder. So your neck and your shoulder get stretched together. And the last one is deep neck muscle strengthening. Go to the bed, lie down for 5 minutes, and then tuck your chin to your chest and hold for 7 seconds. Okay, that is deep neck muscle strengthening. Okay, so just to revise, there were 8 exercises we did here. Trapezius stretch, the first one, it was just basic neck movements with holding for 10 seconds. Second one was using your hand to give a gentle push at the end of the stretch and then coming back to normal. Third one was chin to your chest. Fourth one was right, up, left, and center. Fifth one was strengthening using your hand. You push your hand backwards and your head pushes your hand in the forward direction. The next one was pushing your head to the side and your hand pushing your head to the other side. So basically opposite forces, hence the strengthening. Next, combination stretch. If you're stretching your right side, you pull your right side from the left hand and bend your neck to the left side. And the last one was deep neck muscle strengthening, in which you lie down on the bed and tuck your chin to your chest and hold it for 7 seconds. Right? These were the basic type of neck stretches. Next is shoulder stretches. So the first one here is take your elbow to the back. It's basic tricep stretching. You might know these. Just take your elbow to the back. Use your other hand and push this elbow to the back. Okay? You will feel the stretch over here in your triceps and at the back. Next one is bicep stretching. We're going to skip the second one for now and come to third one first. Third one is bicep stretching. What you do is, if you're stretching your right hand, you take your right hand to the left side and push it with the other hand towards the back. Okay, you're going to feel the stretch over here. Hold it for 10 to 15 seconds for the start, and then move on to holding it for 20 to 30 seconds. The next one is bending your elbow to 90 degrees and use the other elbow to hold it there and block the movement. Try getting your hand up, but the other hand blocks the movement of the first hand. Okay. And the next one is using a pillow. So I have a pillow here. I'm going to show it to you. So like, for example, this is the pillow. You keep both of your hands like this and try squeezing it in. Try squeezing the pillow inside. So you will feel the stretch here on both of your shoulders. Coming back to the second one now. For the second one, you'll have to stand up from your seat and go to a wall. Go to the wall, just keep your hands like this, stretched completely outwards, and try pushing them back. If you try pushing them back through the wall, you will feel the pain here on your shoulders, and hence you will feel the stretch. The last 3 ones can be performed using a dupatta as well. If you have a dupatta or if you have a towel in the house, just tie it on to one of the handles or one of the doorknobs and try doing the movements. The first movement is very simple. You tie it there and you pull it like this in your direction. Second one, you stand in a side standing position and take it from the same side, basically towards your body. And the third one, you bend your elbow and tuck it into your side. Okay, it's very evident from the pictures as to how these 3 exercises are performed. It's not very feasible for me to do it right now, but I think the pictures are very self-explanatory. The next one is exercises for the eye. So eyes do get tired. Eyes actually get tired from the 6 hours of online classes that we do. So these basic eye movements during your lecture will be very helpful. Basically, as soon as your 45 minutes lecture ends, or as soon as the teacher gives you a break, you can perform these basic exercises. As you can see the arrow marks, the first one is up and down, of the eyeball. Second is right to left diagonally. Third one is right to left sideways. Fourth one is rotatory movements. Fifth one is left to right of eyeballs. And the sixth one is anti-clockwise rotatory movements. Very simple exercises and very easy to perform. They will hardly take 5 to 6 minutes. Next, coming on to breathing exercises, which at this point are very, very important for everyone. Okay, here we're going to discuss 8 exercises, which is back-to-back breathing, tummy breathing, elephant breathing, bubble breathing, balloon breathing, shoulder roll breathing, take 5 breathing, and bumblebee breathing. So first, we will be discussing about back-to-back breathing. Okay. Here what you do is, basically you can perform it with one of your siblings or with your mom or your dad. So what you do is you sit down on the floor and then you start breathing. You inhale through your nose and exhale through your mouth. And while you're doing this, your partner can check your chest expansion by sitting behind you. They can just keep their hands on your back and check for your chest expanding while you inhale and your chest relaxing while you exhale. And they can try synchronizing their breaths with your breaths, and hence both of you will be taking deep breaths through your nose and exhaling out through your mouth. The next one is tummy breathing. So you lie on the floor and place a small stuffed animal on your stomach, or something which is very soft and small on your stomach, and you try deep breathing. When you deep breathe, you will see the stuffed toy or the small thing which you've kept on your tummy will come up, and while you exhale, it will go down. So that's the purpose of this, to increase the amount of breathing, to increase the depth of your breath. You inhale so that the soft toy goes up, basically your tummy goes up, and when you exhale, your tummy comes down or the soft toy comes down. Third one is elephant breathing. What you do here is you stand wide apart with your hands relaxed, and then you inhale. While you are inhaling, you take your hands up. You inhale and you take your hands up straight, and then while you exhale, you get your hands down. Okay, so basically taking your hands up and getting your hands down increases your chest expansion and then hence the relaxation. Okay, you take your hands up, your chest area increases, hence your inspiration increases, hence the depth of breath increases. And when you get your hands down, your chest and your lungs relax. The next one is bubble breathing. Sit very comfortably on your bed or on the floor or anywhere you feel, wherever you're comfortable basically. And then begin by closing your eyes. You close your eyes and then inhale deeply. And then when you're blowing it out, blow it out in a way that you're blowing bubbles. Okay, so you inhale deeply and then blow out the air through your mouth in a way that you're blowing bubbles. Next one is balloon breathing. Again, sit in a very comfortable position. Place your hands around your mouth as if you were about to blow up a balloon. How do you do that? You do it like this, right? You hold the balloon and you just hold it like this and the balloon expands, right? So you inhale through your nose and expand your hand in a way that a balloon is blowing up. Or if you have a balloon, try blowing the balloon. Okay, inhale deeply, take the balloon and blow the balloon up. Okay, this is also a very helpful breathing exercise. The next one is shoulder roll breathing. Again, choose a very comfortable sitting position. As you take a slow deep breath in through your nose, raise your shoulders up towards your ear. When you inhale, take your shoulders towards your ear. Breathe slowly out through the mouth, lowering your shoulders as you exhale. Okay, so sit in a very comfortable position. When you're inhaling, slowly inhale and take your shoulders up to your ears. And when you're exhaling, get them down to normal position and relax. The next one is take 5 breathing. What you do here is you sit again comfortably, resting one hand in front of you with fingers outstretched like a star and the other with the pointer finger in the other hand ready to trace your hand. What is to be done here is basically you start inhaling, and while you're inhaling, you start tracing your the other hand with the index finger. You inhale, and when you come to the top, you start to exhale. exhale, exhale, exhale. Then again up, inhale, inhale, inhale. Then exhale, exhale, exhale. Inhale and then exhale. Inhale, exhale, inhale, exhale. You come here and you end the cycle. And you do this cycle 3 times, okay? And the last one is bumblebee breathing. Sit comfortably again. Gently place the tips of your pointer fingers in your ears and close your eyes. Index fingers in your ears and you close your eyes. Breathe in through your nose and then hum quietly as you breathe out. So you put your index fingers in your ears and then you breathe in, and when you're breathing out, you the voice and you breathe out. Okay, these were the 8 breathing exercises which are supposed to be done. Okay, next is we have physical fitness. Okay, so what is physical fitness? I know a lot of you have not been exercising lately because of classes and projects and assignment and weekly tests and exams coming up, but this part of your life is very, very important. Physical fitness is one of the topmost priorities which should be in your priority list as well, and you should focus on it like nothing else. Okay, so what are the benefits of exercise? It basically increases and improves your energy, it improves your brain power, it improves your muscles, your endorphins are released. Endorphins are basically the happy hormones of the body. It helps you become more social, it limits sickness, improves blood pressure, and helps you become more relaxed. Now, how to do exercise? Okay, you might ask, how am I supposed to exercise when there's corona outside? I'm not allowed to go outside the house. I need to stay inside the house. So stay inside and exercise. There are a lot of options inside the house as well. There are a lot of sites doing yoga, online yoga, which you can join. Or there are a lot of fitness sites, fitness apps, which have a 3-month plan or a 6-month plan for various exercises like HIIT or dances or yoga or stretching. Everything is included on those apps. Or you can learn to juggle, learn some new activity, learn something which you have never done in your life, make a movie, learn to juggle, or learn to dance, or do something which you've never done, do some art. Okay, then you can, even skipping is a very good option. If you skip for 30 minutes straight with 10 minutes of warm up in the beginning, it's a very, very great exercise. You can challenge your friends online. You can go online, share a platform, and challenge each other to do. See, you can see how many push-ups can you do and how many push-ups can your friends do. Okay, you can have a push-up challenge, or you can have a abdominal curl-up challenge, or you can have some random exercise challenge with your friends, which motivates you to exercise and hence build up your physical fitness. Right? You can play a lot of games inside the house. You can do dances, or you can just jog inside your house, or just go down for some time and just walk around when there are not a lot of people outside. If you want to exercise at home, just keep in mind to do a 10 minutes warm up continued with 20 minutes of your main exercise which you do, and then end it with 5 minutes or 10 minutes of proper cool down exercises. Okay, you can do activities with your family, sit with them and learn something with them, or play something with them. Break up sitting during school time by moving about. When you're sitting for your classes, don't sit for 6 hours straight. Get up every 45 hours, roam around the house, do your normal neck stretches, shoulder stretches, eye exercises, drink some water, and come back and attend the next class. And check online for some activity ideas. There are a lot of websites telling you what you can do, or teaching you what new can be done, or making you feel better, or maybe teaching you some random activities on how to do craft, on how to do art, on how to cook, on learning a new skill. Okay, so there are a lot of things you can do instead of just using your phone and attending online classes. Okay, so I hope this session was useful for you and will help you improve your physical fitness and will help you in maintaining your correct posture. Okay, so just to see what we actually discussed today was what is physiotherapy. I explained you in brief on how physiotherapy works. Then we had a discussion on what posture we should maintain, which is very important, which I am very sure none of us do maintain, but this is the appropriate posture which is supposed to be maintained throughout. Next stretches, there were 8 basic stretches, which are very easy to perform and will not take more than 5 to 10 minutes. Next were the shoulder stretches, again 10 minutes. Exercises for the eye, maximum to maximum 5 minutes, and it's very important for your eyes, very important for you to do these exercises for your eyes, okay? Because of the online classes and the stress through which your eyes go to, it's very important you exercise them properly. The basic 8 breathing exercises, and what is physical fitness and how you can maintain physical fitness even when you're at home. Okay, thank you so much.